Hi, I'm Dr. Luc Maes, naturopathic doctor and one of the founders of Kaibe. And today I'm here with Tom, our co-founder, who has extensive experience working throughout Africa. For people who are not familiar with Kaibe, Kaibe was founded to discover or revalue the health benefits of wild crops with the goal of preserving biodiversity, promoting economic development in Africa, and bringing you, the consumer, an ingredient such as Baobab that is highly beneficial to your health. Today, I wanted to talk with Tom because his experience is extensive in the field of agriculture development, food security, and now with the recent changes in America's approach to helping communities throughout Africa and understanding that USAID will no longer be available to many people throughout the regions that Tom works. I wanted to learn from Tom, who's on the ground, who's seeing how that is impacting communities throughout the communities that he works in. So Tom, share with us, what are your observations?
Right. Well, thanks, Luke. Good to see you. Good to be here and talk about really topical issues right now. A lot of changes. We can, as you said, I spent a lot of time in Sub-Saharan Africa working with communities in rural areas, often displaced communities. And for decades, a lot of these communities and the governments across Sub-Saharan Africa have partnered with the U.S. government to provide medicine, to provide education, to provide sort of vaccines and sort of service coverage for people all across the continent. And what we've seen over the last 5 months is just sort of pretty much a real, I wouldn't say a wholesale destruction of sort of health systems, but it's amazing how much good the U.S. government was doing in helping countries with their health services. And literally overnight, a lot of these access to medicines, anti-malaria medicines, tuberculosis medicines,
AIDS,
HIV, AIDS, the antiretroviral meds, poof, gone. So a lot of countries had stocks for 2 or 3 months of these medicines, and what we're seeing now, we're into early July, we're going to start seeing in August, September, when those drug stocks are gone. And it's dire. I think we're going to see a lot more childhood deaths, a lot more maternal mortality. It's a tricky situation. I always try to find, what are some of the bright spots of a situation like this. And one of the things we're seeing is that this is really forcing, a reckoning within these governments in Sub-Saharan Africa to figure out how to come up with alternative funding mechanisms, putting more of their budgets towards healthcare, towards education, social services. That was sort of a role that the U.S. government and other governments were helping to play, and a lot of that support is now gone.
So are you seeing that other countries are jumping in to help, or is it only the U.S. that has helped communities to this level?
Yeah, no, I mean, historically you've had a lot of support from European countries, other countries in America, countries in Southeast Asia, Arab countries, but with USAID pulling their funds, unfortunately a lot of European governments have followed the same path.
You're doing amazing work in Uganda. You've been doing amazing work throughout Africa, teaching communities on how to have a way to secure access to food throughout the year. How do you see that changing for you?
The need for sort of regenerative practices regenerative agriculture, the need for a different model of how to feed people is just much more stark. The need is massive. Where we work in northern Uganda, where African Women Rising works, and I support the agricultural side in one of these refugee camps in Baobab refugee settlement. Overnight, half of the organizations providing life-saving services gone. Like, their funding ended one day, and literally the next day they're turning the key, they're locking their gates, and they're driving away. So we have 90,000 refugees, South Sudanese refugees in this settlement, who are entirely reliant on food assistance from the World Food Program, different international NGOs providing health services, adult literacy, nutritional support, all of that. And as I said, overnight, half of the organizations providing that, they left. At the same time, the World Food Program, who was giving out food assistance, slashed the ration size that refugees would get. So literally just several pounds of food a month given, not to everyone, but just to certain refugees now. And so within that situation, that context, the importance of the work that African Women Rising is doing to really work with refugee households and communities surrounding, we call them the host communities. They're the community where the refugees, around the refugee camp. The importance of being able to grow food, more food in sustainable methods. That need is huge.
And your work has been able to convert these arid soil or areas where nothing grows into food forests.
That's the idea. And really, a lot of these landscapes, they're pretty barren. They still get rainfall, but a lot of these landscapes where refugee camps are, the land has become hydrophobic, which means it's eroded. When the rainfall comes, it doesn't percolate in the soil, it runs off. The ground is sort of repelling the water. And so even if we do get rainfall, it's not helpful. It's actually causing more damage. And so our regenerative approaches are, how do you design that little piece of land to be able to absorb that water, to invite the water. We call it planting the rain. We design and we build or dig these water harvesting structures that receive that rain, and we push it deep in the soil. We slow that water down, we spread it out, and it sinks and absorbs in the soil down to where roots of plants can access it, and where it's not going to evaporate, where the wind is not going to dry it out.
How soon do you see something grow? How fast does it?
In some of these gardens, within 2 weeks, people are eating.
In 2 weeks, they have food.
They have food,
whether
it's amaranth greens or cowpea greens. This is in northern Uganda, but we can take a barren piece of land, in 2 weeks people are eating or even selling that produce.
And that's a way to ensure food security throughout the year.
It's interesting, we've just been having this discussion with some colleagues. The idea for these permagardens is to, for 52 weeks in the year, have something available for harvest. And whether you're directly eating that, whether you're able to take that and barter or trade it for something, or to sell it, people have access to that. So these gardens aren't the be-all, end-all, like providing everyone with food security. No, but especially in a refugee setting where there's no employment, someone being able to have a little bit of food each week, or they can gather a couple bunches of these cowpea greens and sell them, that can enable their kids to go to school. That can help pay for transport to go to the health clinic. It can, every little bit of support that they need, they're able to start producing from their own hands in their own garden.
Amazing work, Tom.
Oh, thanks, Luke.
African Women Rising is doing amazing work in Uganda, and Tom's teaching many organizations to make a huge impact. And that's what we're all about at Kaibe, capturing the benefits of wild crops and finding other ways, or maybe additional ways, to have a beneficial effect on communities' health and make sure people can have food with the natural resources that sometimes are not as appreciated. So yeah, thank you for your work.
Yeah, thanks, Luke.